In today's video, we'll be looking at the National Early Warning Score chart, the News 2 chart, which is used to record patients' observation and assessment. In your OSCE, you'll be needing this news chart for all the scenario in assessment station, except when you have a neurological scenario. So when you have either the community scenario or in-hospital scenario, you'll be needing your news chart. Starting from the top of the chart, the name of the patient, the date of birth, as well as the hospital number will have been prefilled. To the left top corner, you see the news key, the color code. So when you see a blank space or a white space on your news chart, it means the patient has a score of 0. When it's a pale yellow, it is score of 1. And when it is amber or orange, it is score of 2. And when it is red, it means it is a score of 3. Now, we're going to be looking at a patient with a respiratory rate of 22 breaths per minute. So starting from A plus B, we're going to look out for that column where 22 will fall under. So 22 falls under 21 to 24. So we are going to write 22 in the box in front of 21 to 24. And we trace that to the middle of the chart. Looking at the middle of the chart, you see that there are some figures there. So those are the score for your parameters. Now, for the score of 22 for respiration, at the middle, that will give us a score of 2. And then the next one, which is the oxygen saturation, still A plus B. In OSCE, you only be needing your scale 1. We have scale 1 and scale 2, but you only been using scale 1 in OSCE. You will never use scale 2 for oxygen saturation in OSCE. So if this patient has a oxygen saturation of 92%, we write 92 in the box in front of the column between 92 to 93. So tracing down to the middle as well, that would give us a score of 2. The next one, which is air, okay, so in OSCE, your patient basically is going to be on air. However, if your patient is on oxygen, all you need to do is the column for oxygen, you're going to write the liters that the patient is on. You write it in the box in front of oxygen liters per minute. But like I said, your patient will be on air. So if the patient is on air, you write capital letter A in the box in front of air. Pressing that down to the middle, that's a score of 0. The next one is the blood pressure. So for news charts, you are not going to be scoring the diastolic. You are going to be scoring only the systolic. However, we still need to write both the systolic and the diastolic on our chart. So this patient has a blood pressure of 130 over 85 millimeter of mercury. So we're going to put an arrow starting from our systolic. So 130 will fall in between 121 to 140. So the box in front of 121 to 140, we'll put our arrow, and then we draw a line from 130 down to the column for our diastolic, which is 85. And 85 falls between the column for 81 to 90. So we'll put our arrow in the box in front of that column of 81 to 90. And we are writing our 85 beside the arrow. Remember, I said we are not going to be scoring the diastolic. We're going to be scoring only the systolic. So if you trace that systolic of 130 to the middle of the chart, that will give us a score of 0. That's a white space. So that's a score of 0. The next one is the pulse. So this patient has a pulse of 82 beats per minute. We're going to look out for the column where 82 falls under. 82 falls in between 81 to 90. So we are writing our 82 in the box in front of 81 to 90. So we put 82 there, trace it to the middle. At the middle, you see it's a white space as well, a blank space. So that's a score of 0. That's a new score of 0 for that pulse. And then for the D part, it's just to measure the alertness of your patient. So your patient will always be alert in OSCE. So you are going to put capital letter here in the box in front of alert. Now, the ACVPU, the C stands for confusion. You can only score your patient for being confused if their confusion is a new onset of confusion using your news chart. Okay, so you can only score your patient for confusion on your news chart if their confusion is a new onset of confusion. If it's not a new onset of confusion, you can't score the patient or confusion on your news chart. And then the V stands for voice. It means the patient can only respond to voice. And the P stands for pain. The patient can only respond to pain. And then the U stands for unresponsive. That means the patient cannot respond at all. So that is the ACVPU. Now, like I said, your patient will be alert in OSCE. So we are going to put capital letter A in the box in front of alert, and then tracing that down to the middle, that's a score of 0. The last one, which is the temperature, this patient has a temperature of 38.2 degrees Celsius. Now we are going to look out for the column that falls under. And looking at this chart, 38.2 falls in between 38.1 to 39, the column for 38.1 to 39. So we are writing 38.2 in the box in front of that column. And if we trace 38.1 to the middle of our chart, we'll see that that is a score of 1. So our news total will now be a score of 5. Now, for us to know the monitoring frequency, we turn to the back of the chart. So at the back of the chart, it says that for a score of 5, that means we'll be monitoring that patient minimum of 1 hourly. So for our monitoring frequency column, we're going to put 1 hourly. Now, we can say the box is small. Of course, it's small. So we can write that in a shortened form. We can write HRY. HRY inside that box. So 1 HRY, that means 1 hourly. The last one is your initials. So if my initials is CO, I'm going to write CO in the box in front of initials, and that is how to score your news chart. Thank you so much for watching. See you some other time. Bye.